Hi, my name is Larrea Young, and I'm a human-centered designer working with a population health organization called HBOM, or Healthy Behavior Optimization for Michigan. HBOM is an agile team of physicians, including family medicine Dr. Tammy Chang and cardiologist Tom Casino, along with population health experts and design practitioners that is working in partnership with collaborative quality initiatives, or CQIs, to improve healthy behavior across the state of Michigan. HBOM identified cardiac rehab as an area of focus for us in the coming years. Why did we choose cardiac rehab, you're asking? Well, for a few reasons. According to the CDC, heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. So, heart health is this hugely important issue that we want to focus on. And according to Million Hearts, people who attended 36 sessions of cardiac rehab have a 47% lower risk of death and a 31% lower risk of heart attack than those who attended only one session. And not only has cardiac rehab proven its clinical value and positive outcomes for patients, but it is also low cost and saves the health system money. So, what's the problem, you might be asking? Well, also according to Million Hearts, only 10% of eligible patients with heart failure are referred, and less than 3% of those attend at least one session. So, very few people who could benefit from this amazing and life saving service are getting access to it. And what we've heard in our conversations with stakeholders is that the referral process is getting much better. In fact, several health systems in Michigan have over a 90% referral rate. Seriously, you guys rock. And we also heard that once patients walk through that door for that first session, they really want to stay in the program. It's fun, they feel good, they feel supported, and all of that is so awesome. But the problem is getting patients to that first session. I think it's something we can all understand. You just had a major scary health crisis. Now, not long after, you are being asked to leave the house, drive to what could be a very long distance, to meet people you don't know in a strange environment where you're going to be asked to work out in front of other people. That's a big deal. So, how can we help patients feel supported so that they make it to that first session? We would like to kick off a pilot program to deliver tailored messages about cardiac rehab to patients while they are still in the hospital after a cardiac event. We envision this in the form of beautifully designed cards containing messages of support from patients and providers, along with information about cardiac rehab and next steps to enroll. To create the cards, we would host a creative call through our cardiac patient and provider network, asking for messages, design ideas, images, poems, tips, or anything else people would like to share. We will then turn these impactful ideas into stunning cards that feel personal and meaningful to patients. Sets of these cards and additional educational materials will then be delivered to health systems to be distributed to patients who are a good fit for cardiac rehab. Care providers can even write a personal note or sign the card if they choose. If you are wondering what this process would look like, we have hosted similar, very successful creative calls to design waiting room posters for tobacco cessation and type 2 diabetes. Not only does it generate beautiful and impactful visuals, but it also creates buy in from providers and empowers and uplifts diverse patient voices, two things that we think are really important in cardiac rehab. And we believe that this project is a joyful and low cost way to help patients feel supported in enrolling in cardiac rehab. And research has clearly demonstrated the positive impact of tailored messaging, and this also touches on two critical prongs of behavior change: getting the recommendation of someone who is a trusted expert, like your doctor, to change your behavior, and the support of your peers in making that change. We hope that you're excited about this project as we are, and please reach out to us with any questions or check out our website at hbomish.org. Thank you.